So, welcome to this episode of Diversity, Equity, and Inclusion, together with my partner in crime, Dr. Mirvat Alasnag. And we are delighted and really honored to have Professor Barbara Casadei with us. Professor Casadei is head of National Heart and Lung Institute under Imperial College London, and she was a British Heart Foundation Professor of Cardiovascular Medicine, an honorary consultant in cardiovascular medicine at Oxford University Hospitals, NHS Trust, and the lead of the cardiovascular team of the National Institute for Health and Care Research Biomedical Research Center. She was the first female president of the ESC, European Society of Cardiology, where she established the European Cardiovascular Patient Forum, Women in the ESC, and EuroHeart, an international collaboration that aims to advance the standard of care and build a European-wide infrastructure for pragmatic clinical trials. Professor Casadei has had a global impact on cardiovascular medicine, spearheading an internationally leading bench-to-bedside research program on atrial fibrillation and spanning investigations from human tissue and cells to clinical trials. Uh, Professor Casadei, Barbara, actually, I would like to thank you for being here today, and it's a great honor for us to have you. And I would like to start with the first question. I would like to take you to the recent statements of EACTS and STS, the surgeons, who have taken some measures against bullying, disrespect, and other harmful behaviors. What is your opinion as past president of the ESC about how we can address these behaviors?
Thank you very much. Thank you for having me. It's my honor. I would say that any society, environment, department, institution should have, by default, zero tolerance to any disrespectful behavior. The important thing is that disrespectful behavior is reported not only as the victim, but also as the spectator of this happening. And it's important that any institution, including a scholarly society like the European Society of Cardiology, should have a policy that this is not acceptable, and also a way of an escalating set of measures that they may want to have to deal with these occurrences that hopefully are not too frequent. So I do applaud the societies that have addressed this. I know that the ESC has had first a gender policy and now a task force on gender. And I would say it would be good if this was actually discussed and implemented in the context of these activities.
Barbara, I'd like to draw on your experience as a president of a society. We've all noticed that women are challenged throughout their career. And I remember distinctly when you became a president, I was sitting with you in one of the conferences, and I had asked you, at what point in your career do these challenges fade away and you just assume your role? And you said it actually doesn't. You still face challenges of a different kind, even when you're president. How did you handle them, even at your level? And what would you tell the younger generation women who are seeking opportunities to join societies and hopefully assume similar leadership roles?
I would say that the societies welcome women. I have, for reason that we can understand and discuss, sometimes found it difficult to engage women in the society. So I've asked a lot of women to put themselves forward, to do this and that. And I haven't always had a positive answer. I am not, by saying that, complaining about women. I mean that many years, the optics of these societies, particularly in cardiology, where you have for many, many years almost exclusively a male leadership, may actually make women think, do I really want to go there? So it is understandable, but it has to be overcome, I think. One way of dealing with it, do I say it? Sometimes is to ignore it. Carry on. You know, don't say, oh, but if, and oh, I am, yes, that's all that is true. We've rehearsed it for decades. And at the end, you just say, and actually, I don't care, and I'll go for it. And that would be, and I built around me a structure of people who can support me in doing that. I need to have allies. I'm not doing this solo. I need to have, a group of people around me that understands what, and also they can call, they can feel free to tell me, look, I think you are going a bit too far on this, or maybe not enough on that. So it's very important to have that system around one, but it's particularly important not to let the system get you.
That's very interesting, and thank you so much. And based of that, I was thinking that equally men and women, young people, sometimes they don't get the recognition that they feel they would have. And would you advise them like to have more resilience or to have a low threshold to change the workplace? What advice would you give to these people?
It's a very good question. So I must say that uh, when I was a mid-career researcher, um, the government of the United Kingdom put this kind of initiative, the research assessment exercise for each department, the REF, but now is now called. And that meant that every head of department, every department, they had to go through the CVs and the activity and the contribution of every person in the department. And that made my career, because finally people actually had to look at what I was doing and appreciate that I was making a substantial contribution. And they only knew that through this exercise, because I did not, and that is wrong. I did not go to the head of the department office and say, hey, here I am and I'm doing all this, like my male colleagues might have found easier to do. So, you know, every time there is an opportunity to show what you're doing, take it. And if there isn't an opportunity, make an opportunity to go and talk to the leadership of your department and say, just wanted you to know that I am now doing this, that, and that I have published that paper, that I got that grant. Make sure you're visible. Because in the life of a head of department, there is so much noise and sometimes not enough connection and communication that you may notice exactly everyone that there is in there. I'm doing my very best to do that, but I know that I might still miss something. So be very proactive in telling people what you're doing, what you're proud of, the achievement, or what you are hoping to do. People need to know. They need to know what are your ambition and how much they can rely on you. For instance, for the even the internal organization of the department, because you want to engage, volunteer, engage, communicate, find the opportunity.
I would like to shift gears a little bit and talk about research. We all recognize that there's paucity of data when it comes to outcomes, cardiovascular outcomes in women. And the Lancet Commission really did allude to that very well in their publication. I'd really want to pick your brains on how we can change that and move forward and achieve gender equity in research, but also how we can get more women PIs and trialists involved in the research engine.
Yeah, again, a very good question. I feel that the issue of having women recruited in trials of common cardiovascular diseases, for example, it's actually a tricky one. If you look both at the data from the TIMI group and the data from Oxford, it seems clear that once invited, women are much less likely to accept to come to a screening visit, then they are much less likely to accept that they're going to be randomized. They have a higher rate of dropout during the run-in phase of a trial, and also their adherence to both active and placebo treatment is lower than their male counterparts. So I think it is very important to actually dig into these issues and try to understand why that is. My impression is that particularly for ischemic heart disease, women have a perception of risk that is perhaps not realistic. So essentially, they think that if you look at those risk scores and things like that, they think that the risk is low, even if they have already had an event. I'm talking, for instance, of trial recruiting women in secondary prevention, right? And as such, they think that they have more to lose than to gain in participating in a clinical trials. Their actual benefit of a new treatment is not at all clear to them, not at all clear the risk-benefit ratio. So you could say, are women less risk-prone than men? I don't think so. I do think that we need a different way of demonstrating cardiovascular risk to women, like life curves, years lost, rather than you're going to have more than 10% of risk of a cardiovascular event or something like that, because that doesn't seem to communicate, to stick. And so I think that is very important. I mean, people say, oh, it's because women do not have time to come to this visit. But actually, if you look at pretty visit intensive population studies, it's very much easier to get to 50-50 male and women. So it's not that they cannot look at UK Biobank, for instance. So it's not that women can't do it. It's just that they don't want to do it particularly. They don't see the point clearly, I think, and they don't like the idea of trying a new treatment. So I think these really are factors of communication, education, co-creation that really need to be addressed. Otherwise, we will be forever. One of the reasons why I was also keen in funding EuroHeart was exactly that, because if you have a very large pool of patients, then you can enrich for women. If you are running a trial in the UK and 7% of the invited women accept who have, let's say, had a major cardiovascular events, then you are really running out of the ability to enrich for them. And so you end up with your 19% of women in the trial or something like that. So I think it is very important to actually understand why this is happening. So that's on the participation of women in clinical trials. The point of women involved in clinical trials, again, has different layers. So in some respect, you need to think of what it is that attracts you in that position. So if you want to make a difference and you think that you have a very strong feeling of what needs to be done, then you are training for that kind of figure, that is the person who is an investigator-led trial facilitator, essentially. So you have to have a very clear mission, a way to explain it, and contacts with a device or pharma company that might buy into your trial. And here there is diplomacy, persuasion, ability to run it, infrastructure, partnerships that are important. In other cases, the trial is essentially almost entirely run by pharma. And then you have a figurehead, right? That is a figurehead. They may have some input, but depending, it may also not have any input. And so in there, is more like, am I part of that particular group? Right. And so you need to break into it's a very conservative, small group of people that are the figureheads for commercial, essentially, trials. So, you can be a bit of both, yeah, but there is a difference because, you want to train to become a person like that. You then need to train in the right environment. So, let's say that Teeny, Duke, and Oxford have been able to do both. And if one trains in that environment and works in that environment, then you have those opportunities. And in fact, Oxford has several women who have been PIs of very large trials and are PIs of trials right now. And that is a combination of industry and investigator-led working with industry rather than working for industry. Essentially, you need to be where these things happen in order to get the connection, the training, the infrastructure that allows you to have that credibility towards the companies you may need to work with, almost necessarily, that you will be able to deliver. It's not a solo mission. You need to have around you an infrastructure that guarantee that you are going to make it. Otherwise, you may be chosen because someone wants a woman or someone wants a woman of color or someone, but that is not, is a way in. I am not, I think one should get any opportunity, but you want to succeed, right? And be noticed for your ability. And for that, you need to be trained and to have an infrastructure.
Thank you so much. That's amazing points, and we learn a lot from you. And after all this fruitful discussion, we reached the end of this podcast. We would like to thank you for participating. You're a role model for us, and you've been the first ESC president. You've achieved so much. You lead the way for all of us, to follow. And really grateful for being here today. Thank you.